Shoulder arthritis develops when the smooth cartilage lining the ball and socket joint gradually wears away. As the bones begin to rub together, you feel a deep ache, stiffness, and sometimes a grinding or catching. Reaching overhead, out to the side or behind your back becomes harder and more painful. The ache is often worse with use and can disturb your sleep at night. It usually comes on slowly over years and is more common with age or after an old injury. Many shoulders are managed for a long time without surgery, especially in the earlier stages. Gentle exercises guided by a physiotherapist help keep movement and strength around the joint. Anti-inflammatory medication can settle the painful flares, and a cortisone injection into the joint can give useful relief. Easing heavy overhead activities takes some of the strain off the worn joint. When the pain becomes constant and limits daily life despite these measures, a joint replacement can help. A shoulder replacement resurfaces the worn joint with smooth implants, much like a hip or knee replacement. When the rotator cuff tendons are intact, an anatomic replacement restores the natural ball and socket. When the cuff is worn or torn, a reverse replacement is used, which swaps the ball and socket around so the remaining muscles can power the arm. It is done under anesthetic through an incision at the front of the shoulder, usually with a short hospital stay. The aim is to relieve the pain and restore comfortable, useful movement. The arm rests in a sling for around 6 weeks to protect the new joint while it settles. Physiotherapy starts gently within the first few weeks and moves through stages: protected movement first, then active movement and strengthening later on. Pain relief is usually noticed early, with movement and strength building over the following months. It asks for patience, as a shoulder replacement keeps improving for a year or more. Keeping up the program gives the best long-term result.